Hi, I'm Carla Schimmelfinnig, registered physical therapist for the past 25 years, and welcome to InjuryGuru.com. Have you been struggling with neck pain and stiffness that just doesn't seem to be getting any better? Or maybe you're one of those that has episodes of neck pain, whether it lasts for 3 days or even up to a few weeks. If that's the case, then stay tuned because there is something that you can do about it. From my own personal experience, as well as my experience with many patients, I have seen just how limiting neck pain can be. For those of us who have neck pain on a daily basis, we get done what we need to get done, whether it's at work or at home, but we suffer through with just that nagging, aching neck pain. Maybe you are one of those who have been to physical therapy in the past with little to no change. And if that's the case, just do me a favor, try my exercise program just to see if maybe this will help decrease some of your pain. Let's talk about the location of that pain and what patients most often describe. Most of my patients will say that pain is located on one side or the other, but it can be on both sides of the neck. They will describe that pain in the back of the neck, extending down toward the shoulder blades, across both shoulders or one shoulder, or even into the upper arm. They'll typically describe that as anything from aching and dull to a sharp pain with certain movements. Most of the time, my patients either tell me they have lost motion, or I find that they've lost motion in certain directions. Other patients say they have trouble sleeping. Either they can't sleep very well, so they don't get good sleep, or they wake up in the morning with a lot of pain and stiffness until they start to move and get around, and that pain will start to decrease. If that's the case, then just stay tuned to the end of this video because I'll show you a couple little tips you can do and use to hopefully sleep more comfortably and get better sleep. What we find as therapists is that most of the patients we see that come to us with neck pain are suffering from degeneration. And you might say, okay, what is degeneration? Degeneration in the neck is simply what you know as arthritis. And whether that's from wear and tear, maybe from a certain job, or it's hereditary, or maybe you have had an injury in the past and now it's coming back to cause you some trouble. What we find, though, is with that degeneration, you start to lose motion or mobility in those delicate neck joints. And that then starts to cause pain over time. And that pain and limitation starts to affect the muscles and ligaments all around that area. And then you end up in a vicious cycle. So it tends to cause more pain, more limitation, and more weakness and trouble with the ligaments and the muscles. So what I have found over many years is that by restoring some of that normal motion in the neck, and then trying some good specific exercises, we can actually break that vicious cycle and help decrease or even get rid of the neck pain and episodes of neck pain that you've been having. If you're one of those that has neck pain, but you also have pain that extends all the way down the arm and maybe even into the hand, maybe you have numbness and tingling or a weakness in that arm or that hand. If that's the case, if I'm describing you, then wait no longer. I want you to go and see your doctor. You need to let your doctor evaluate your neck and take a look at it. And it may be that you just need more intervention. Maybe you need to see a physical therapist who can get their hands on your neck and do you some good. If you're one of those that I've described, so you're listening to this, you say, yeah, that sounds like my neck pain. then like I said, give this exercise program a try and see if we can't decrease some of that neck pain that you've been having. Now, I did promise that I would show you a couple little tips to help you sleep a little more comfortable. So at this point, if you definitely are having that pain that I've described, I will tell my patients to try to avoid sleeping on their stomach. It's just not good for the neck at this point. I want you to try to sleep on your back or on your side. When you sleep on your back, I want you to make sure that the pillow extends all the way down toward your shoulder blades and then up toward the top of your head. I don't want that pillow to be too thick so that it just pushes your head forward, and not too thin that your head is sagging down toward the bed too much. When you sleep on your side, I want you to try this little tip, which is just a rolled up hand towel. So I just got a hand towel from my bathroom and rolled that up. And what you're going to do is place that in that space between the neck or between the head and the neck, that space that when we lay on our side just doesn't get a lot of support. In fact, for some of us, it just gets no support at all. And so it can just be nagging and uncomfortable. So you can use that with your pillow. So when you're laying on your side, you can just take that rolled up towel and put that in that space that just doesn't seem to get enough support. If you don't want to try a towel, then at least take your pillow and roll that pillow up if you can on that front edge to just kind of shove it into that space that's created here when we lay on our sides, so that it does give your neck some support. Now, the last thing we need to do in this video is check your motion in the neck, because I want you to see and feel if you have some pain, stiffness, or loss of motion, or all three. So let's check that normal motion that you should have. So go ahead and check that with me right now. You should be able to turn to the side like that. Again, notice if you have some pain or stiffness when you do that. And another motion you should be able to do is bringing your ear down toward your shoulder like that. And you want to check both sides again. The last motion I want to show you, I'll show you from the side. You should be able to look up and back that far, and as well as forward and down. Now, most of us don't have trouble looking down and forward. That's pretty much where we live life, whether we're at work or we're at home. We're bending forward a lot, leaning forward, and so we don't typically have trouble with that. Most of us will have trouble looking up and back, and again, whether that's pain or just stiffness, loss of motion, or both, and we'll also have trouble turning side to side and bending side to side. Maybe your neck pain and limited motion is such that you already know, yeah, I can't turn very far to my right, or I can't turn very far to the left. So what I want you to do is just make a good note, so take a good mental note of your limitation and your pain with those motions, so that as you're going through this program and this process, you can check that each week to see if it is getting better. So if your motion is improving and you're having less pain, that's the most important thing. That's the whole reason we're doing these exercises. The other thing that I want you to know, just know your limitations, so that when I do show you specific exercises, you'll know which to emphasize to see if you indeed can't change that motion, improve that motion, and decrease your pain. All right, so now you have everything you need to get started in this exercise program. So if you definitely are having the pain that I've described, then just give this exercise program a try, and let's see after a few weeks if we can't decrease your motion, restore some of your normal motion, and decrease your pain, and get you back to doing the things that you need to do with less pain and just being more comfortable on a daily basis.